Good afternoon, and thank you for taking time out of your day to come to this beautiful venue. We're going to have an announcement today to help describe plans to deal with our surgical backlogs. I'm going to introduce our leader, the Premier of the province, the Honourable Dr. Andrew Furey, for some comments.
Well, thank you, Minister, and good afternoon, everyone, and thank you for joining us here today. What a difference a day makes, eh? Just last week, we came together for an exciting announcement about the partnership with the University of Ottawa Heart Institute to address the wait list for cardiac surgery. This partnership is a true testament to our ability to find innovative ways to address the challenges in our already stressed healthcare system. Healthcare systems, not unique to Newfoundland and Labrador, but across the country and around the world, are strained after the pandemic. And here in Newfoundland and Labrador, our dedicated professionals have unfortunately had the added challenge of the cyber attack. We know each and every one of them works so hard and are dedicated to providing the utmost care to Newfoundlanders and Labradorians. And we say it, but we don't say it enough. Thank you for anyone who is out there who's a healthcare professional on the front lines for what you do. As an orthopedic surgeon, of course, I have the honor of working alongside many of you and caring for patients together. And I know that the number one priority we all share is quality of care. So today, I'm very pleased that we are here to announce yet another solution to address surgical backlogs in our province. This time, it's a little close to my heart, it's for hip and knee joint replacements. This important surgery continues to be integral in returning people to their normal lives, and it's the two of the most common performed procedures across Canada, with more than 138,000 hip and knees being done each year at an estimated inpatient cost of $1.4 billion annually. Before the pandemic, approximately 1,700 joint replacements were done each year here at Newfoundland and Labrador alone. Then, of course, we were hit by a state of emergency caused by Snowmageddon, followed by the pandemic, and followed yet again by the cyber attack on our healthcare IT systems. It's kind of crazy when you stop to think about it that all the hardworking healthcare professionals had to absorb all of that while caring for all of us. Our healthcare professionals, people in health authorities, and the bureaucrats in government have dealt with all of this at great sacrifice, often to themselves and their personal life, while accomplishing and continuing to accomplish significant changes in our system, making it possible for a sustainable future. These shutdowns, of course, came with a cost. The number of non-urgent elective surgeries performed, including hip and knee replacements, took a toll. Consequently, roughly 900 fewer joint replacements were performed in the last 2 years, causing, of course, a backlog of patients. As a surgeon, I know firsthand what that means for those patients waiting on those lists. It's frustrating, I can tell you as a surgeon, and I know the nurses share this, to have to deliver the news that you're delayed yet again. People waiting in pain, waiting to return to their normal lives, for their families, for everybody involved in their care. So I knew we had to start thinking outside the box and thinking differently to develop a solution to address the backlog of patients waiting for these joint replacements. Now I can tell you, the orthopedic surgeons and Dr. Au and his colleagues have advocated for this for quite some time, to think outside the box and how we can deliver these procedures outside of hospital without an inpatient stay. This has changed significantly in recent years. Dr. Au and I were residents together, and I can tell you, at that point, oftentimes, hip and knee replacements would spend 5 to 7 days in hospital post-op. Well, that has been steadily changing across the country in the last 5 years. In fact, 7 other provinces throughout the country perform same-day joint replacements, with this approach becoming more and more common since the start of the pandemic and the pressures that it created. That's because recent advances mean that patients mobilize more quickly, and we know the scientific benefit of it for them more quickly immediately after surgery, and therefore can go home on the same day. So I'm delighted to announce today that Newfoundland and Labrador will adopt this approach in an effort to address surgical wait times for hip and knee replacements in our province. Our goal is to perform up to 20% of joint replacements each year as outpatient day surgeries. Mr. Diamond will provide more details on the specifics, including the timelines to get this approach fully implemented and up and running. As I said last week, we are working to reduce surgical wait times across all surgical specialties. Today's announcement aligns with the task force we established recently with the Newfoundland and Labrador Medical Association to look at surgical backlogs and to try to think outside of the box to provide meaningful solutions to address the backlog and, most importantly, to continue to provide quality care to the patients we serve. I'd like to thank Mr. Diamond and his team with Eastern Health, including my good friends and former residents, I mind you, the Clinical Chief of Orthopedics, Dr. William Moores, who couldn't be here today, and Dr. Keegan Au. To Minister Haggie and our dedicated staff at the Department of Health and Community Services for their continued efforts to put the shoulder to the wheel when we always go to them with new ideas, innovative solutions. The answer isn't we can't, it's how can we accommodate? How can we think outside the box? How can we make this system sustainable moving forward? So to the hardworking people in the department, thank you. And of course, to each of our partners and stakeholder groups working tirelessly within the system, healthcare providers, nurses, doctors, allied health professionals, volunteers, and of course, to the patients. Thank you for being patient as we come out of this pandemic. Thank you very much.
Thank you very much, Premier. And again, I would like to echo his thanks to the Department of Health and Community Services staff. They have worked really hard and really well with Eastern Health and the clinicians on this, and they are to be commended. As mentioned by the Premier, Mr. Diamond, the President and CEO of Eastern Health, is going to now describe their role and some timelines and how this program will roll out from the point of view of the Health Authority. Mr. Diamond.
Thank you very much, Minister, and good afternoon, everyone. It's great to have you here. On behalf of Eastern Health, I want to say thank you to Premier Furey and to Minister Haggie for bringing us together once again. In addition to Dr. Au, who's been acknowledged here, we're also joined today by Dr. Angela Bussey, who is Eastern Health's Clinical Chief of Surgical Services, and Lynette McCarthy-Woodrow, who's our Director of Regional Surgical Services, both of whom have been very much involved in this initiative. And I'd also acknowledge the board chair of Eastern Health as well, Mr. Leslie O'Reilly, is with us. Welcome, and welcome everyone. Growing wait lists for elective surgery, like hip and knee replacements, were an unfortunate result of the COVID-19 pandemic, not just here in the province, but across the country, as the Premier has already mentioned. At Eastern Health, we certainly appreciate how difficult it has been for patients who have had their procedures postponed or rescheduled over the past 2 years. Providing same-day joint replacements is a significant step towards reducing those wait lists and getting patients back on their feet, literally on their feet, sooner. Of course, changing the way we do these surgeries for patients who qualify for this approach requires significant preparation, and that work's already begun. Over the coming weeks, we will be updating the former nuclear medicine unit at St. Clair's Mercy Hospital to accommodate this new approach. The space will extend the current day surgery unit and create spaces for preparing and recovering patients who have had outpatient joint replacement. We will also be creating a room where specially trained staff will use a variety of tools and equipment to get patients up and moving sooner after their surgery. This new approach will require dedicated staffing, and so 4 new full-time positions have been created, and recruitment has already started to recruit 2 registered nurses, a physiotherapist, and a clerical support person. This approach will employ innovative changes in practice and protocols, which have already been proven to be very effective in other jurisdictions. These changes will allow for safe and same-day discharge and promote best possible outcomes for these particular patients. We're aiming to have all of this in place by the end of the summer so that we can begin offering outpatient joint replacement surgery to eligible patients as soon as early fall. Our goal is to perform 20% of all joint replacement surgeries as outpatients. And we'll begin with 2 outpatient cases a day on a Monday to Friday basis, then expand that to 4 cases per day, 5 days a week, for a total of approximately 200 cases per year. We're indeed fortunate to have a top-notch team of orthopedic surgeons, including some in the room today. So we have top-notch surgeons, we have fantastic registered nurses and physiotherapists and other dedicated staff here at Eastern Health who are passionate and excited about advances like this in medicine and patient care. I extend my thanks and appreciation to everyone who's been working hard over the past weeks and months to advance this new approach. I have the utmost confidence that they will shine once again as we work together to deliver innovative, high-quality patient care. Together with their commitment to our patients and the support of the provincial government, Eastern Health looks forward to many more years of advances in healthcare. This is always, of course, with the goal of delivering the best possible, most timely care for the people of Newfoundland and Labrador. That's what this is about. We hope that we'll have many more of these announcements, Premier, as we go and improve not only care in our surgical program, but across the many services that Eastern Health and the other regional health authorities in the province provide every day to the patients of Newfoundland. Once again, to the government, thank you, and thank you all for being here.
Thank you, Mr. Diamond. I too look forward to further announcements, although I don't think it's a state secret that there might not be one next Thursday. From my point of view now, it gives me great pleasure to introduce one of our homegrown talent, our orthopedic surgeon, who's come today to give some details from the clinician's perspective and the kind of service delivery front end of what this program will do and how it will benefit the people of this province. So I'd like to introduce Dr. Keegan Au, who's an orthopedic surgeon with Eastern Health. Keegan.
Thank you, Minister. Thank you. Just as a member of the orthopedic surgery team at Eastern Health, just like to express thanks to Minister Haggie, to the Premier, and also to CEO Mr. Diamond for inviting us to participate in this exciting announcement for our service. Patients waiting for orthopedic surgery procedures at Eastern Health comprise the largest group of patients on the surgical wait list at Eastern Health right now. And of those, patients awaiting hip and knee replacement procedures make up the majority. As Mr. Diamond mentioned, the COVID-19 pandemic has clearly done us no favors, as surgical wait lists right now are significantly longer than they were 2 years ago. The adult orthopedic surgery service at Eastern Health has gone to great lengths to try to maximize the resources that are available to us, and we have essentially maxed out what we can accomplish within our existing system. Our wait list, however, continues to be a problem. As Dr. Furey already mentioned, patients awaiting hip and knee replacement surgery, their problems are more than just elective ones. Okay, those are ones that clearly affect their quality of life by affecting their mobility, and they need to be given some priority. This is why today's announcement is so important, and we are welcoming this as an important step towards allowing us to complete more joint replacement procedures at Eastern Health facilities than can presently be accommodated under our existing system. This funding will enable us to create capacity by offering joint replacement procedures to a subset of patients on an outpatient basis where they can have their procedure and go home on the same day. This will reduce our dependence on inpatient stay and on the availability of inpatient beds. In collaboration with our partners in anesthesiology, nursing, other allied health, that we will employ the same methods that are used in many other centers and some of the methods that we've been using for many years now that have proven to be safe and effective at achieving good outcomes for our joint replacement patients. As same-day protocols have been used in other centers across North America, we have the distinct advantage of being able to pick some of the best practice guidelines and learn from the experiences of others in order to ensure effectiveness and safety for the patients that we are going to enroll into this program. The funding announced today will be used to get same-day joint replacement program off the ground at Eastern Health. It will support both the physical infrastructure needs and also some of the needs as far as human resources. Some examples of the infrastructure has already been mentioned. We have an area that's going to be renovated at St. Clair's Hospital, and this area will be used to help safely mobilize patients after their surgery and create an area where they can recover in their immediate postoperative period. Some of the human resources needs will include nurses and physiotherapists, as Mr. Diamond has already alluded to. This is really exciting news for our service, and more importantly, really exciting news for our patients. And I can speak with confidence in saying that we really look forward as an orthopedic group at collaborating at all levels to make this initiative a reality. We appreciate this, and I know that our patients will too. Thanks for your time.
Thank you very much, Dr. Au. Another announcement to deal with the aftermath of the pandemic. This province did remarkably well and can hold its head up on an international level with that effort against COVID-19. We recognize from the evidence we have numerically that cardiac surgery was an issue. We came forward with a proposal and a plan and an MOU to address that. Orthopedic and joint and hip replacements are, as Dr. Au described, a significant challenge. And here are creative ideas as to how to get to grips with that in a way that speeds up our recovery from the backlog issue from COVID-19. I'd like to thank everybody for coming today. The live stream will end shortly, but for the benefit of the media, we will be available to take questions, and we'd be happy to do so. So again, thank you very much for coming and taking your time today. Take care.